Welcome once again. One of the questions that we get asked about is, self-medication or self-diagnosis. So there are instances when you feel unwell. You probably have a fever, a tummy ache, joint pains or things like that, and you opt to go to the nearest chemist, get some medications, and voila, 2 or 3 days later you're feeling better, you're fine. Is it a bad thing? Is it a good thing? This can be difficult. We always advise that you should see a health professional whenever you're not feeling well. It's not a good habit to go for over-the-counter medications without proper checkup. So it would be nice if you went and saw a doctor, get yourself examined, do some relevant blood tests or any kind of test, and have something going on before you are put on medication. Most of the time though, some of these ailments are minor and probably caused by viruses. And in most cases, if it's caused by a virus, it will come and it will go on its own. And most of the time, those things don't really need any medication. It's just a matter of time and they clear on their own. So the concern here really is the abuse of medication. Many people would take antibiotics, many people would take painkillers whenever they're not feeling well. And it's this habitual use of medications that are not proven to be useful for that condition you're suffering from that can be problematic. Some of these medications can be injurious to your organs, your liver, your kidney. Some of these medications have downstream effects that are detrimental to your health. And the other concern we have, especially with the unregulated use of antibiotics, especially when you get antibiotics from over the counter, is we are encouraging antibiotic resistance, which is an issue. As you people know, that we started off without antibiotics. We had no medications to kill germs back in the day. Then penicillin came in, and within a short time, resistance, organisms or germs were becoming non-responsive or resistant to penicillins. And newer medications have had to be developed to counter this resistance from germs. And with time, we're running out of options. We are getting to situations where we have certain bugs that do not respond at all to any antibiotic, and that's a concern. And this is caused by this careless and unregulated use of antibiotics for any ailment. So it's always good to get advice from a health professional, a doctor or so, and be advised accordingly, and don't use antibiotics unnecessarily. And the advantage of being tested is that then we can know, from basic blood tests, we can know whether you have a viral infection, whether you have a bacterial infection, whether you have malaria, or maybe you're just having some other ailment that does not warrant the use of antibiotics. So it's always good to go and get tested and get checked. So in short, we generally do not advise the use of over-the-counter medications without proper testing because of the risk of harm to your health by these antibiotics, harm to your health by painkillers, and the development of antibiotic resistance. Those are the concerns that we have, and that's why we don't advise people to take medications from over the counter without the advice of a health professional.